A very good evening to all the eminent doctors. Thank you so much for joining us for today's webinar. Our endeavor to spread awareness about rabies, which is fatal, but can be avoided once appropriately vaccinated. This is an initiate from Cadila through its innovation to serve the society and humankind. The topic of webinar is novel 3-dose G protein vaccine, ultimate key for compliance. Dear Dr. Travis is the world's first novel 3-dose anti-rabies vaccine. And with great pride, we would like to inform you that Travis has successfully completed 1 year of launch with more than 40,000 animal bite victims being vaccinated. 100% compliance was recorded and no case of ADRs was registered. With this, it's my honor to introduce you to speaker of today's webinar, Dr. Janendra Gyanu, which is MBBS MS ENT NIMS Jaipur. And especially I know about him, Dr. Janendra Gyanu is one of the leading MS ENT in Katihar town. And now I would like, now all the participants can drop their question in drop box and we'll read out all the question after the presentation. Now session is hand over to Dr. Gyanu sir.
Thank you. Thank you, Shivanand and Cadila Pharma. Thanks for giving me opportunity to present this slide. This is a very important topic that dog bites and animal bites are very common in India, and thus the rabies is one of the most challenging topic for us, and vaccination is very important in case of any animal bite. So today we are going to discuss a new vaccine launched by Cadila Pharma, that is novel 3-dose G vaccine. It is a 3-dose vaccine, and it is ultimate key for compliance. Rabies is a public health challenge in India. Globally, 59,000 human deaths annually, highest in India. India had 20,000 human deaths a year from rabies, accounting for 60% of the rabies deaths in Asia and 35% globally. 91% deaths in India occurred in rural areas. So every 9 minutes, a person dies from rabies. The current management protocols for the treatment of rabies is local wound treatment, that is first aid, then active immunization vaccines, and passive immunization, that is rabies immunoglobulins. For local wound treatment, washing the wound with soap water and running water, not bandaging the wound, not suturing the wound. These are the common local wound treatments that is to be done after any animal bite. Then active immunization is vaccine. There are many vaccines that were available in the market, and with the course of time, the vaccine has improved. The passive immunization, that is rabies immunoglobulin, most commonly used is human rabies immunoglobulin, which has less side effects and are very active in giving the immunization, the passive immunization. Previously, the 5-dose intramuscular regime, which was very common, and it was to be given at 0, 3, 7, 14, and 28 days, and sometimes as a booster dose, it can be given on 90 days also. But it has a challenge. So the current challenge of post-exposure prophylaxis is non-compliance, as the number of doses is too much, so many people forget to get the appropriate dosing. The current rabies vaccine are cell culture vaccine, and inactivated vaccines are more than 50-year-old technology. So they are inconsistent in potency, stability, they are short supply and has some adverse events. So non-compliance is one of the most major challenge. The compliant for patients who receive the full course of anti-rabies vaccine, that is scheduled dose of ARV on the recommended dates. Delayed compliance to complete the scheduled dose of ARV within 16 days, but deviated from the scheduled regime. And dropout or non-compliant are those who had taken at least one dose of ARV after animal bite, but not completed all the scheduled dose. The rabies post-exposure prophylaxis in routine practice in view of new Centers for Disease Control and Prevention and World Health Organization recommendation. So, the limitation of 4-dose WHO recommendation, a retrospective analysis done at travel clinic, a total of 110 patients who received rabies 4-dose PEP, and the shortcomings and management of these patients were late initiations of rabies PEP in travelers, administration of human rabies immunoglobulin, and antibody level less than 0.5 IU per ml in 6 of 9 patients after 4 doses of vaccine. The patient, so conclusion is patient do not always receive optimal rabies post-exposure prophylaxis under real life condition, and a significant proportion of patients did not develop adequate antibody level after 4 doses of vaccines. This is a non-compliance of 5 doses, and all of them has proven to be the cause of death. The reason of death may be due to lack of administration of rabies immunoglobulin or poor compliance of vaccination. As you can see, the only cause of death that is diagnosis considered is rabies encephalitis. And a compliance of post-exposure prophylaxis among animal bite patients, a hospital-based epidemiological study by Mansi Panda and Richa Kapoor at Safdarjung Hospital, New Delhi. About 360 animal bite patients were in the study, and a pre-designed, pre-tested structural questionnaire was administered by the interview techniques. 53% were non-compliant to the full course of anti-rabies vaccine. So, the other study also shows that the compliance rate for intramuscular rabies vaccine was 60% on day 28. That means most of the patients, either they don't take the anti-rabies vaccine, or they don't want to complete the vaccination. The constraint for compliance to complete course of anti-rabies vaccines are interferes with the school timing, distance of hospital, the cost incurred, and forgotten dates. And the evolution of rabies vaccine. The rabies vaccine has evolved with the time. In 1885, the first was live attenuated vaccine derived from a spinal cord, non-standardized dried preparation, and up to 31 injection of increasing immunogenicity. Then came in 1911 the inactivated vaccine and minimum neural content liquid preparation. 14 injections were needed, each 0.5 ml daily. Now, the vaccine that was in use which is also used till now, is inactivated vaccine and standardized immunogenicity lyophilized, and 5 injection, that is 0, 3, 7, 14 and 28. These are the schedules at which the vaccine has to be taken. So, non-compliance led to the evolution in treatment regime from 31 dose to 5 dose and is still on. So, meeting the unmet, the medical need, a new vaccine has been introduced. So, introducing a novel vaccine which is simple and shorter regime. The novel 3-dose recombinant rabies G protein vaccine, the novel G 3-dose recombinant rabies G protein vaccine has some of the benefits. It is first protein subunit vaccine prepared by VLP platform technology, the first vaccine with 3-dose that is only 0, 3 and on 0, 3 and 7 days. Better compliance due to easy flow regime and less visit, and convenience, ready to use and no reconstitution is needed. Now, what is VLP technology? In VLP technology, the native virus is introduced in VLP as converted to VLP as vaccine. So the G protein is difficult to stabilize. G protein isolation using VLP technology purified and stabilized by Cadila Pharmaceuticals Limited. Virus-like particles are proteins complex and exist as nanoparticles. VLP are similar to native virus particle, but they do not contain the viral genome. They cannot replicate but can mimic the viral antigenicity without being pathogenic. And they are capable of inducing a shorter humoral and cellular immune response. So VLP is that acts as a vaccine. There are clinical trials and clinical phase 2 study design along with the Rabipur vaccine was done, and safety and immunogenicity of novel 3-dose recombinant non-nanoparticle rabies G protein vaccine administered as a simulated post-exposure immunization and randomized comparator control multi-center phase 3 clinical study done by Ravish HS and et al. They evaluate the immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. And the randomized comparative study, controlled multi-center study, total 800 patients were done in the randomization of 2:1. The reference is from the Rabipur vaccine. The efficacy, the results were consistent across the different age group and gender, and observed difference 1.52% with the pre-specified margin of -4%. The non-inferiority for seroprotection primary endpoint day 14 and 42 were met. Test and comparators are identical in seroprotection rate both on day 14 and day 42. The novel 3-dose has better safety profile as significantly less adverse effects compared to the reference vaccine. The study conclusion. The novel 3 was non-inferior to reference vaccine, has less adverse effects compared to reference vaccine, and novel 3-dose was found to be safe and immunogenic and was comparable to 5-dose of WHO pre-qualified vaccine. It has also got many awards, the Pharma Innovation of the Year by Economic Times and the Golden Globe Tiger Awards, Award Malaysia for Innovative Products of the Year. So with this, we end the topic. Thank you.
Sir, what?
Am I audible, sir? Am I audible, sir?
Sir, rabies का लक्षण क्या है? What are the sign and symptoms?
Rabies is a very deadly disease, and the hydrophobia, aerophobia, the convulsions, these are the, and laryngospasm, these are the common symptoms of rabies, which actually occurs within the 5 days, 5 to 10 days, or it may even delay into the years also. So these are the symptoms, and patient usually die due to rabies. Till now, there is no treatment if a person just got the rabies. So prophylaxis against rabies is very important, because after rabies, there is no treatment, and person dies due to the different symptoms of encephalitis, rabies encephalitis. Those are the aerophobia, water phobia, hydrophobia, then the convulsions, and the person finally dies.
Sir, the one question, sir. What are the advantages of three dose?
There are many advantages of 3-dose, as we saw in the slides. In clinical trial, it is just similar to the conventional vaccine that are available in the market. And the 3-dose, which is itself a very compliant, and the person can take the 3 doses of vaccine instead of 6 doses, and they will not forget to take it. Since the duration is also very short, within a week, vaccine can be completed. So 3 doses is more compliant than other rabies vaccines.
And sir, last question, sir. What types of animal bite cases come across that apart from dog?
Basically, any animal bite, after any animal bite, prophylaxis should be taken, whether it is a dog, whether it is cat, whether it is rat, or it may be from horse, camel, any animal bite. If a person is getting any type of animal bite, they should get a prophylaxis of rabies.
Sir, one more question from my side. Am I audible, sir?
Yeah, you are audible.
Sir, myself Siddharth, I'm from the marketing team of the Kadima Pharmaceutical. I'm directly streaming this webinar from the head office of the Kadima Pharmaceuticals. So I just want to ask one thing, sir. What if the person get a bite in the initial initial days after taking the vaccination? Is there any time period like for a 3 months if you got the initial any time period for after the vaccination?
They should get the vaccination should start within the 72 hours.
Within the 72. But my question is, sir, after taking the vaccine, if the person gets bitten again by a stray dog or a straight dog, so is it necessary to take the vaccination again?
Actually, they should get the immunoglobulin therapy also,
Okay.
and they should take. I think they should take the booster dose.
Okay. So there are some booster dose available, sir.
As we saw in the Rabipur, after 28 days vaccine, there is one more schedule for 90 days. That may be considered as booster dose.
Okay. Okay. So, sir,
In
one
case
more
of
question.
means after 1 or 2 years, if anyone gets the animal bite, they should complete the vaccination.
Okay, so there is one booster dose available if the person is get bitten by any pet dog or any stray dog.
No.
during the
Actually, in the Rabipur vaccine, there is one more schedule for 90 days that acts as a booster for that vaccination schedule. But if someone gets bitten by an animal, again after 2 or 3 years, they should complete the vaccination schedule.
Okay. So that's a mandatory process to complete the schedule.
Yes.
Okay, sir. One more question I just came into mind. Like, have you any basically the rabies occurs due to the dog bite? Mostly 95% to 97% of the rabies cases are found with a dog bite. Have you came across with any other animal bites who apart from a dog bite? Have you came across with any? Can you please share me your experience?
Actually, dog are more common among the human habitats, so the dog bites are more common. But the monkey bite, that is very dangerous because we cannot trace the monkey whether it was a rabbit or not. Then the bat bite. Bats are the reservoirs of rabies virus. They actually act as a spreader of rabies virus to different animals. So all animal bite can cause the rabies.
Okay, so basically not only dog bites, in fact the monkey's bites are too common as well as the bat bites are too common.
The cat bites are also very common.
Okay, so is it something related to bite or even scratch?
No, it also bite and scratch. There are different grading of the infection, injury. So first is a scratch or a lick on a scratched skin. That is also exposure to, that will be also considered exposure to rabies virus.
Okay, okay. So that's all from my side, sir, doctor. And it was a very nice and very informative session with you, and almost 50 plus participants have joined this live session. And I hope this will be a great informative and a great session for all of us. And with this, it is I'm very proud to announce that Crabis has won the two innovative awards in the category of the innovation category, that is Indian Pharma Award as well as a Golden Globe Tiger Award. And it is it's a proud moment for all the Indians. Like now we have the 3-dose vaccine available in the market. Who have And we are taking a pledge to overcome the market of 5-dose conventional anti-rabies vaccination what is available in the market. And it's all with this. I'm going to take a pledge of making a rabies-free India. And thank you, doctor. And it was a great informative talk, and we truly appreciate your efforts. And latest but not the least, make India a rabies-free. Thank you so much, doctor. Thank you.
Thank you.
Thank you. Thank you so much, Dr. Gyanu sir, for the information talk. We truly appreciate your effort. Last but not the least, we would like to inform you that Travis has won 2 prestigious awards in innovation category, ET India Pharma Award and Golden Globe Tiger Award. So from the bottom of heart, lot of thanks, sir. Thank you, sir.
लाइव सेशन बंद कर दो ना सर।